welcome to the Asia and the Pacific Policy Conference 2014, hosted by the Crawford School of Public Policy at the ANU. My name is Belinda Thompson, and I'm here with Dr. Tenneth Dalipanda, who is the Acting Permanent Secretary for Health in the Solomon Islands. Dr. Dalipanda, we talk a lot about how complex the aid landscape is. Can you describe for us just how complex it gets in the Pacific?
It does pose a big complex to the small countries and island states in the sense that it is increasing in numbers, become complex. They have different indicators that we have to meet, different reporting framework, which is sometimes not aligned with our ministry's indicators. So in actual fact, that becomes very complex when you have to do all these different reporting, different financial procurement in terms of doing our core role within the ministry. So, and the sheer number of partners that are coming in also over the years is gone quite high. And that makes it very difficult for small countries where you only have very few people doing a lot of things in the ministry. So once you have to report for 3 or 4 different partners, it becomes very complex.
So you've got the bilateral agencies, the UN organisations, the not-for-profits and civil society sector organisations. You know, you've got other governments and other bodies coming in with some of the vertical programming. How hard does it make it when you're trying to balance all of those donors for the country? How hard is it for the Solomon Islands?
It's difficult. I mean, we do have the traditional partners. For example, DFAT. Used to be OSAID before, now it's DFAT. DFAT has moved, aligned most of the activities within the ministry and working with us in terms of improving some of the health systems. Other partners are new into the ministry, in the landscape, and they come with a program that already pre-planned from their side. So, for example, we want to work on reproductive health. We might have some partners already working in reproductive health. Maybe a UN partner or WHO is already covering that. So when you have a new partner going there without coming to us in terms of when we do the actual annual operational plan, then those that are coming in are not actually on plan. They are not on budget as well. So it's very difficult for our program to actually absorb extra activities that are brought into the ministry. So what we are wanting our partners is when we do our annual operation plan, they should come up with where they are going to be working in, what areas, what program, so that we can actually put them on plan and see our team can actually implement those plans. Or do we need extra people that we can hire under a project in order for us to implement? So these are the challenges that we have. And some of them don't come to what we call our partners coordinating team. They're just new, so it's posing us a very big risk in terms of meeting our targets.
So do well-meant programs designed by donors sometimes place an undue burden on the country?
I think they are well-meant. The intention is good. We don't deny that. We just want those plans to be part of our plan so that we are able to actually implement them. The Pacific are very small countries. I mean, Solomon is a little bit big. Others probably a little bit much more smaller, which means that one person looking after several programs. And if a program which is well-meaning, well-designed, but not on plan, and this person has to do, they have different reporting template as well. And it can become a very big challenge for that person to actually implement it, manage and implement it. So what we would like is basically all our partners are welcome, but we need to sit together and harmonize those vertical programs that are funding to our plan, so that we have, in some ways, plan on how we implement. We need extra people to move to that program in order to meet those targets. We could hire them under their assistance to do maybe a project hire personnel to assist in that program. But under the current staffing, we might not be able to implement. And sometimes in terms of getting, doing some of the activities, they might, even for training, for example, workshop, they can take staff away from the duty station and to conduct this training, and the service that we provide at the facility can be affected if that is happening. So we really need coordination to ensure that we don't drop our activity just in order to absorb a program that is imposed on us. Yeah.
So I know that in all Pacific Island nations, but also in the Solomon Islands particularly, there's been some non-traditional donors coming in, China, Korea. How are they working with the existing programs?
Yes, we don't have a diplomatic relationship with China, but we do with Taiwan, which is Republic of China. And they are, most of the activity they do is not on plan and not on budget. It's completely outside. They focus mainly on certain areas that, especially the hospital, clinical areas, providing equipments. So it doesn't really sort of affect the program because they don't do primary health care, they don't do public health. They're only doing, supporting the lab in the hospital, equipment, renovation of hospital staff, providing some clinicians. So that's Taiwan. So although they are not on plan, not on budget, they tend to be doing just the hospital. So I think the hospital team are working with them very closely. Korea is a new, KOICA is a new partner coming into the country. That posed a little bit of a difficulty for us because they were never part of the consultation that we have with our development partners. So their approach is a bit direct. They want to do some activities in the areas of child health, reproductive health, which already got maybe 4 or 5 partners in there already. So, but somehow the contract is been signed without some of us knowing. So we plan to sit with them and have some serious discussion about how best we could actually implement what they had in mind in their funding arrangement.
So before donors come to you proposing projects, what questions would you like them to ask themselves and to think about before they meet with you?
In the Solomons, what we have in the Ministry of Health is a donor coordinating body. So we quarterly, this group meet, and all the interested and partners who are already operating in the country actually attend this meeting to ensure that they are coordinating among themselves and also with us. So that's one of the things we put. What we want them to do is to first to look at our national strategic plan and to see what area in the strategy they want to contribute in. And then after they identify that, then they come to us. If it's, say, in the area of HIV, we would like them to have a meet with the HIV team and maybe the Undersecretary who looks after HIV and put forward what they have in mind. This is usually best to be done around April of the year, because then the planning process starts at that time for 2015, for example. So around April is when all the programs, the budgeting team are starting to put the operational plan. And even earlier will be better, so that they capture all these activities, they put them on plan, they understand the scope of that work. Do they need extra people to come in and actually implement it? Or is the current staffing under the HIV and the province are able to cope with it? So that will be our suggestion. And we always ask for them to be part of the development partners coordinating team that we always meet every quarter.
And just on a local issue for the Solomon Islands, I know that you had quite devastating floods earlier this year. How is the Solomon Islands coping with those and recovering from that devastation?
Yeah, very interesting. In the conference, we always talk about double burden of disease. I beg to differ. In fact, we have quadruple burden of disease, including disaster and emerging diseases like outbreaks. So those are big challenge for some countries. And Solomon, we have a huge dengue outbreak last year. We had a tsunami first in one of our provinces. And then while we were responding to that, we had a dengue outbreak. So that throws every plan off timing, sort of derail most of our activity. And then early this year, around the same time in April, we have flash flooding. And that involves two provinces, mainly Guadalcanal and the Honera city area. So up until now, we are still, recovering in terms of rebuilding the clinics that were damaged. We got some assistance from WHO through the UN SAFE Fund to rebuild those clinics. I think about 6 of them that were damaged during the flooding. And then now we have a measles outbreak, which our team are responding to. So far, we have more than 1,000 cases that is been detected, 3 days out of measles. So to us, we haven't fully recovered. We are still going into recovery phase, rebuilding, and then we have another outbreak of measles that comes. So I think we should escalate from double burden of disease to quadruple disease. Natural disaster and climate change with emerging disease are a big, serious problem for some of Pacific countries.
Thank you so much for your time, Tenneth.
Thank you.